Today, we're talking about Eric Menendez returning to prison after being hospitalized for kidney stones. Quite a headline, right?
Definitely. The Menendez brothers' case has always been in the spotlight, but health issues like this remind us they're human too.
True. Kidney stones are no joke. I wonder what kind of medical care someone like Eric gets in prison compared to outside.
That's an interesting point. Medical care in prison is often criticized. I imagine it's a pretty stark contrast to what's available outside.
Yeah, and considering the stress of prison life, health problems might even be more common. Do you think Eric's case brings attention back to broader issues in the prison system?
Absolutely. Whenever a high-profile inmate faces a health crisis, it sparks debate about prisoner rights and care standards.
And the media coverage seems relentless. Why do you think people are still so fascinated by the Menendez brothers?
I think it's the mix of family tragedy, crime, and the ongoing legal twists. It really reads like a true crime drama.
Speaking of drama, do you think moments like these, hospital visits, health updates, change how the public perceives Eric and his brother?
Maybe a little. It's hard to demonize someone when they're suffering, but then again, the crime itself is what most people remember.
Right? Some people might even see this as a chance for the brothers to gain sympathy, while others just see justice being served.
And then there's always the question, should prisoners get the same level of health care as the general public?
That's a tough one. Basic rights versus consequences of their actions. Why do they get to benefit from committing crimes?
For sure. And it makes me wonder about other inmates with serious health issues who don't make headlines. They might not get the same attention or care.
Exactly. The Menendez case is unique because of its fame, but it highlights systemic issues. Any final thoughts?
Just that stories like this remind us how complicated justice and humanity can be. Maybe our listeners have their own opinions on prisoner health care.
That's a great point to leave our audience with. Thanks for joining us, and see you next time.